Today we'll be talking about hepatitis B, which is a condition that affects the liver. In this webinar, in order to help you better understand what hepatitis B is, we'll be going over some basic information about hepatitis B. But first, let's talk about what the liver does. The liver keeps your body healthy by taking away toxins in your blood, such as alcohol or drugs. It also helps to break down fat from food into energy. So, what is hepatitis B? Hepatitis B is a liver disease that's caused by the hepatitis B virus. It's sometimes abbreviated as Hep B. It's especially common in Asian communities. About 1 in 12, or 8% of Asian Americans have hepatitis B. The hepatitis B virus causes inflammation of the liver tissue, which can affect liver function. If left unmonitored, it could lead to serious health problems such as liver cirrhosis and liver cancer. Hepatitis B is one of the leading causes of liver cancer. The only way to know if you have hepatitis B is to get tested, and by knowing your status, you can prevent it from becoming a more serious disease. Many people with hepatitis B don't experience symptoms at all. 2 out of 3 Asian Americans with hepatitis B don't know that they're infected, and for this reason, they call it a silent killer. However, symptoms can include fever, nausea, yellowing of the skin and eyes, and fatigue. How is hepatitis B transmitted? Hepatitis B is spread through contact with an infected person's blood and body fluids. It can be transmitted through sharing needles or blood transfusions. It's most commonly transmitted from an infected mother to her child during childbirth. Practices such as sharing toothbrushes and razors or having unprotected sex with an infected person could also put a person at risk for getting hepatitis B. The hepatitis B virus is not spread through casual contact. Sneezing, sharing food or drinks, coughing, and kissing will not transmit it to others. Many people with hepatitis B think that they can't eat dinner together with their family or even share utensils because they're afraid they will spread it to them. However, that is not the case, and it's important to understand how transmission actually happens.
We were all sitting at the dinner table, everyone except Dad. I asked, "What is hepatitis B anyway? Why can't Dad eat with us anymore?" My mother answered, "Because you might catch it from him." I was confused when I found out about my father's diagnosis. No one in the family was willing to talk about it, so I thought that it must be something like flu that goes away on its own. But we weren't allowed to have dinner together anymore. My mom wouldn't let us use the same utensils. When I tried to hug my dad, he backed away from me. As I grew older, I looked online and I read community resources to learn about how hepatitis B is actually spread. It's not spread by sharing dinner or using the same chopsticks or spoon. It's not spread by being close or by hugging family members and loved ones. But so many people believe that it is, because the people around them tell them so. Later, when I started working as a Hep B advocate, I supported other immigrant and refugee patients. Their stories of families and communities remind me of my own. I heard their fears of losing their jobs and their friends and family if they talked about it. But we need to talk about it. Looking back, I realized how much my father missed and how much he suffered. I missed out too. Just be knowledgeable.
In Kat's story, her father was afraid to share meals and even hug his family members because he thought that he would spread hepatitis B to them. There's still a lot of misunderstanding around hepatitis B, and people don't talk about it because they think it'll affect their ability to get a job and affect their interpersonal relationships. However, if we all talk about hepatitis B and understand how it's actually spread, we can make more people aware of what it is. Doctors may not always test for hepatitis B during checkups, so it's important to make sure that you have definitely been tested. Who should be tested for hepatitis B? Hepatitis B testing is recommended for people born in Asia, people whose parents were born in Asia, and people who live with someone with hepatitis B. Hepatitis B is also common in certain foreign countries, which I can explain in the next slide. This map shows the rates of chronic hepatitis B infection around the world. Hepatitis B is common in areas such as Asia, Africa, South America, Eastern Europe, the Middle East, and the Pacific Islands. People born in these countries have a greater risk of being infected with hepatitis B. As we mentioned earlier, hepatitis B is a silent disease, and the only way to know if you have it is to do a blood test. When you test for hepatitis B, you should be testing for 3 things. First is the hepatitis B surface antigen. If this result is positive, it shows that you are currently infected with hepatitis B. Second is the hepatitis B surface antibody. If this result is positive, it shows that you have immunity and are protected against the hepatitis B virus. Last is the hepatitis B core antibody. If positive, this shows that you were exposed to the hepatitis B virus in the past. If you were previously exposed to hepatitis B, there is a chance that the hepatitis B virus can come back if your immune system is weakened by a certain type of medical treatment, such as chemotherapy. Those who do not have hepatitis B and do not have immunity can get vaccinated. There is a vaccine that can protect you from getting hepatitis B. Currently, there are 2 to 3 types of vaccines available. The first type consists of 3 shots given over 6 months, and the other type consists of 2 shots given over 1 month. Different vaccines are used for certain populations, and you can discuss with your provider if you need to get vaccinated. Now we will watch a short video that shows how getting vaccinated can protect your liver from the hepatitis B virus. There is currently no cure for hepatitis B, but by monitoring and treating hepatitis B with a provider, those living with hepatitis B can still lead happy and healthy lives. It's recommended that those living with hepatitis B regularly follow up with their doctors every 3 to 6 months to monitor their condition. Medication with hepatitis B antiviral drugs can reduce the virus levels in your body. This can reduce the risk of transmission to others and also prevent further damage to the liver from hepatitis B. Those with hepatitis B should avoid drinking alcohol and smoking, as these practices can further damage the liver. Conditions such as fatty liver can also make hepatitis B worse, so it's important to keep a healthy body weight and exercise. It's best to discuss with a doctor before taking any over-the-counter drugs, supplements, or herbal medications, because these can also have side effects on the liver. Because the hepatitis B virus can be spread from a mother to her child when she's giving birth, it's important that pregnant women know their status. Pregnant women with hepatitis B should see an internal medicine provider and an OBGYN doctor to talk about how to manage their condition. If you're pregnant and have hepatitis B, talk to your doctor about ways to reduce the risk of spreading it to your baby. Tenofovir disoproxil fumarate, or TDF, is the only hepatitis B medication approved for pregnant women. You can protect your baby from getting hepatitis B. Babies born to mothers with hepatitis B should receive 2 shots at birth, the first dose of the hepatitis B vaccine and hepatitis B immune globulin, or HBIG. After the baby receives the 2 shots at birth, it's safe to breastfeed. The baby will need to complete a total of 4 shots within 6 months of being born, and this gives more than a 95% chance of being protected against hepatitis B. If you're not sure if you or your family members have been tested, Charles B. Wang Community Health Center has a program that provides free hepatitis B screening, vaccination, and education. Our hepatitis B team can help you set up an appointment to get tested. You will not have to pay any money, and you can still participate even if you don't have insurance or citizenship. If you'd like to set up an appointment to get tested, please give us a call at either our Manhattan or Flushing locations. Our Manhattan number is 646-276-6142, and our Flushing number is 718-661-6368.